1. A nurse is caring for a patient with COPD who reports increased shortness of breath and produces green sputum. What should the nurse do first? Answer. Notify the healthcare provider immediately to report signs of a potential infection. Rationale. Green sputum may indicate a respiratory infection, which can exacerbate COPD. Early intervention can prevent complications such as pneumonia or respiratory failure. 2. A patient with COPD is scheduled for discharge. What is the most important teaching point regarding oxygen therapy at home? Answer. Instruct the patient not to smoke or be near open flames while using oxygen. Rationale. Oxygen supports combustion, and smoking near oxygen significantly increases the risk of fire or explosion, posing a life-threatening hazard. 3. The nurse is caring for 4 patients with COPD. Who should the nurse assess first? 1. A patient with SpO2 of 88% on room air. 2. A patient with loud expiratory wheezes. 3. A patient with minimal sputum production. 4. A patient with increased use of accessory muscles. Answer. A patient with increased use of accessory muscles. Rationale. The use of accessory muscles indicates increased work of breathing and potential respiratory distress, which requires immediate assessment. 4. A nurse is delegating care tasks to a nursing assistant for a patient with COPD. Which task is appropriate to delegate? Answer. Assist the patient with morning hygiene and ambulation. Rationale. Nursing assistants can assist with activities of daily living. The RN should retain tasks involving assessment, teaching, and evaluation. 5. A patient with COPD becomes increasingly confused and drowsy. What is the nurse's immediate priority? Answer. Assess oxygen saturation and prepare to administer supplemental oxygen. Rationale. Confusion and drowsiness in COPD patients may indicate hypoxia or CO2 retention. Oxygen therapy and further assessment are urgently needed. 6. The nurse is reviewing arterial blood gas results for a patient with COPD. Which result is most concerning? Answer. A PaCO2 of 60 millimeters of mercury. Rationale. Elevated PaCO2 indicates hypoventilation and respiratory acidosis, which can lead to CO2 narcosis and require immediate intervention. 7. During morning rounds, the nurse observes a COPD patient lying flat in bed and experiencing shortness of breath. What should the nurse do first? Answer. Assist the patient into a high Fowler's position. Rationale. High Fowler's position facilitates lung expansion and improves breathing in patients with COPD. 8. A patient with COPD is prescribed albuterol via nebulizer. What instruction should the nurse give during administration? Answer. Instruct the patient to take slow, deep breaths through the mouth during the treatment. Rationale. Deep breathing allows the medication to reach the lower airways, enhancing effectiveness. 9. A COPD patient reports taking 3 different inhalers, but frequently forgets the correct order. What should the nurse emphasize? Answer. Use the bronchodilator first, followed by the corticosteroid. Rationale. Bronchodilators open the airways, allowing better absorption of the corticosteroid medication. 10. A patient with severe COPD and low energy levels refuses pulmonary rehabilitation. What is the best nursing response? Answer. Explain the benefits of pulmonary rehabilitation in improving quality of life and energy levels. Rationale. Education can motivate participation by highlighting positive outcomes like increased exercise tolerance and reduced symptoms. 11. A COPD patient is at high risk for malnutrition. What dietary recommendation should the nurse provide? Answer. Eat small, frequent meals high in protein and calories. Rationale. Small meals prevent fatigue during eating, and high-protein foods support tissue repair and energy needs. 12. A nurse finds a COPD patient with oxygen saturation of 85% on 2 liters per minute nasal cannula. What should the nurse do next? Answer: increase oxygen flow as ordered and reassess saturation levels. Rationale: oxygen saturation below 88% requires adjustment per provider order to prevent hypoxemia and complications. 13. A patient with COPD becomes anxious and starts to hyperventilate. What is the nurse's best initial action? Answer: encourage pursed lip breathing to promote controlled ventilation. Rationale: pursed lip breathing slows exhalation and reduces air trapping, improving gas exchange and reducing anxiety. 14. A patient with COPD is prescribed theophylline. What is a critical nursing consideration? Answer: monitor serum theophylline levels to avoid toxicity. Rationale: theophylline has a narrow therapeutic range, and toxicity can lead to serious side effects like arrhythmias and seizures. 15. The nurse is preparing to administer influenza and pneumococcal vaccines to a COPD patient. Why is this important? Answer: these vaccines reduce the risk of respiratory infections that can worsen COPD. Rationale: preventing infections helps reduce exacerbations and hospitalizations in COPD patients. 16. A patient with COPD is receiving oral corticosteroids. What is a priority teaching point? Answer: do not stop the medication abruptly. Tapering is necessary. Rationale: abrupt cessation of corticosteroids can cause adrenal insufficiency and withdrawal symptoms. 17. A COPD patient is admitted with acute exacerbation. Which diagnostic finding would indicate effective treatment? Answer: decreased dyspnea and improved oxygen saturation levels. Rationale: clinical improvement in breathing and oxygenation reflects successful treatment and stabilization. 18. A patient with COPD asks why breathing is more difficult when it's humid. What is the nurse's best explanation? Answer: humid air is denser and can increase airway resistance, making breathing harder. Rationale: high humidity adds resistance to airflow, which can exacerbate COPD symptoms and reduce comfort. 19. A nurse notes a COPD patient's respiratory rate is 32 breaths per minute. What is the priority nursing action? Answer: assess for signs of respiratory fatigue and notify the healthcare provider. Rationale: a high respiratory rate suggests distress. Early intervention can prevent respiratory failure. 20. The nurse is assigning patients on a respiratory unit. Which patient with COPD is appropriate to assign to an LPN? Answer: a stable patient needing routine nebulizer treatments and medication administration. Rationale: LPNs can manage stable patients and administer medications, but RNs must handle unstable or complex patients requiring assessment. 21. A patient with COPD is prescribed tiotropium via inhaler. What instruction is most important for the nurse to provide? Answer: instruct the patient to rinse their mouth after inhalation. Rationale: rinsing the mouth helps prevent oral thrush, a potential side effect of anticholinergic or steroid inhalers. 22. A nurse observes a patient with COPD using a meter-dose inhaler incorrectly. What is the most appropriate nursing intervention? Answer: demonstrate proper inhaler technique and have the patient return demonstrate. Rationale: ensuring correct use improves medication effectiveness and empowers patient self-management. 23. A COPD patient expresses fear of becoming dependent on oxygen therapy. What is the nurse's best response? Answer: explain that oxygen therapy is prescribed to improve function and reduce complications, not to create dependence. Rationale: addressing misconceptions and educating on the purpose of oxygen supports adherence and alleviates anxiety. 24. A nurse is developing a care plan for a patient with COPD who has activity intolerance. What is an appropriate intervention? Answer: schedule rest periods between activities. Rationale: rest periods help conserve energy, reduce fatigue, and allow the patient to participate more fully in daily activities. 25. A patient with COPD refuses to participate in coughing and deep breathing exercises. What is the best nursing action? Answer. Explore the patient's concerns and explain the benefits of secretion clearance. Rationale. Understanding the patient's perspective and educating them supports adherence and improves outcomes. 26. A COPD patient's family asks why the patient breathes through pursed lips. What should the nurse explain? Answer. Pursed lip breathing helps keep airways open longer and makes breathing more effective. Rationale. It prolongs exhalation, reduces air trapping, and enhances ventilation in COPD. 27. The nurse is caring for a COPD patient with a history of carbon dioxide retention. What is a safe oxygen delivery approach? Answer. Administer oxygen at low flow rates and monitor ABGs closely. Rationale. High oxygen levels can suppress the respiratory drive in patients with chronic CO2 retention. 28. A patient with COPD and COR pulmonale shows signs of peripheral edema. What nursing intervention is most appropriate? Answer. Monitor intake and output and assess for fluid overload. Rationale. COR pulmonale can lead to right-sided heart failure and fluid retention. Fluid balance monitoring is essential. 29. During a home visit, the nurse notes clutter around a COPD patient's oxygen equipment. What is the nurse's priority action? Answer. Educate the patient on maintaining a clear and safe environment around the oxygen source. Rationale. Clutter increases the risk of tripping fire hazards and impedes emergency access. 30. A COPD patient reports difficulty sleeping at night due to breathlessness. What is a helpful nursing recommendation? Answer. Sleep with the head of the bed elevated or in a recliner chair. Rationale. Elevating the upper body reduces the work of breathing and promotes better sleep in COPD. 31. A nurse is caring for a patient with COPD who becomes increasingly agitated and restless. What is the priority action? Answer. Assess for hypoxia and check oxygen saturation. Rationale. Agitation and restlessness may be early signs of hypoxia. Prompt assessment prevents complications. 32. A COPD patient complains of a dry mouth due to inhaled medications. What is an appropriate nursing recommendation? Answer. Suggest sugar-free gum or frequent sips of water. Rationale. These measures help relieve dry mouth without interfering with medication effectiveness. 33. A patient with COPD and a long smoking history asks about smoking cessation. What is the nurse's best initial action? Answer. Assess the patient's readiness to quit and offer support resources. Rationale. Tailoring interventions based on readiness improves the likelihood of successful smoking cessation. 34. The nurse is educating a COPD patient on preventing exacerbations. What key points should be included? Answer. Avoid crowds and practice good hand hygiene during cold and flu season. Rationale. Preventing respiratory infections is essential to reducing COPD exacerbations. 35. A patient with COPD is experiencing thick secretions and difficulty clearing them. What should the nurse recommend? Answer. Increase fluid intake if not contraindicated. Rationale. Adequate hydration helps thin secretions, making them easier to expectorate. 36. A patient with COPD has a nursing diagnosis of ineffective airway clearance. What is an appropriate nursing intervention? Answer. Encourage use of an incentive spirometer every hour while awake. Rationale. Incentive spirometry helps promote lung expansion and mobilize secretions. 37. A COPD patient tells the nurse they stopped taking their medications because they didn't feel better right away. What should the nurse do? Answer. Educate the patient on the importance of continued use and the time needed for effects. Rationale. Consistent use of COPD medications is necessary for long-term management and symptom control. 38. The nurse is assessing a COPD patient with a barrel chest and diminished breath sounds. What does this assessment finding indicate? Answer. Chronic hyperinflation of the lungs. Rationale. A barrel chest results from long-term air trapping and hyperinflation common in COPD. 39. A newly diagnosed COPD patient expresses frustration and depression. What is the nurse's priority intervention? Answer: provide emotional support and offer a referral to counseling or a support group. Rationale: psychosocial support is essential in chronic illness to improve coping and mental health. 40. A nurse is preparing discharge instructions for a COPD patient. What is a critical teaching component regarding medications? Answer: emphasize taking medications as prescribed, even when feeling well. Rationale: ongoing medication adherence helps prevent exacerbations and maintain disease control. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!